the challenge that we face in terms of the cancer burden is enormous. In the US and globally, cancer is a leading cause of death. The risk of cancer death is about 22% in men and 19% in women. There are racial gaps in some cancer types. And the increasing incidence with age indicates that cancer will become a greater burden as our population ages. And this problem is exacerbated by the fact that there is a projected workforce shortage in oncology and cancer care, and an increase in cost of cancer care. And in particular, in our community in the Bronx and beyond, we have a large minority population. There are high rates of smoking, obesity, HIV, and comorbidities. There are high poverty rates and a large elderly poor population. And there are language and cultural barriers to care. So all of this amplifies the enormity of the challenge that we face as clinicians serving this population. Cost is another huge factor that we can't ignore. The number of cancer survivors is expected to increase from about 14 to 18 million between 2010 and 2020. That produces enormous stress in our healthcare system to provide adequate care for these patients in a very efficient and compassionate way. The total cost for cancer care in 2020 is projected to be about $170 billion, representing about a 40% increase over a decade. And the authors concluded of this analysis that the national cost of cancer care is substantial and expected to increase because of population changes alone. And our findings have implications for policymakers in planning and allocation of resources. So this represents an enormous challenge for an integrated healthcare delivery system like ours. And this doesn't even take into account the skyrocketing cost of drugs. There is good news, and that is cancer mortality is declining in the US. And this is largely because of increased screening and improved systemic therapies for early stage disease. However, a racial divide remains, and the cancer burden in the minority population that we serve is increasing. So shown here are cancer incidence on the top. The spike in men is due to PSA screening. And on the bottom, you see starting in the 1990s, there's been a decline in cancer-related mortality. On the right is shown breast cancer mortality. And you could see it's declining for both whites and blacks, but remains substantially higher for the black population. And on the left, this racial divide is illustrated further, because you can see that comparing non-Hispanic blacks compared with non-Hispanic whites on the bottom left, blacks have about a 50% higher risk of breast cancer mortality. The silver lining for the black community has been breast cancer rates are always lower. But for the first time in 2015, breast cancer rates in black women equaled what they were in white women. So this just, again, highlights the enormity of the challenge that we face in managing the population.